Hello, we're going to review how to perform the central venous catheter dressing change using our Rainbow Babies and Children's job instructions. First, you'll need to gather your supplies. You will need your universal central line dressing kit, non-sterile gloves, and any additional supplies that are needed. Prepared saline flush and blue threaded lock cannula will be needed if fluids are infusing. Disconnection of IV fluids is recommended during dressing change. Dressing kit contains 2 pairs of sterile medium gloves. Obtain larger or smaller sterile gloves if needed. Obtain a stat lock or other securement device if in use. This assures all supplies are available once sterile dressing change procedure has begun. The second pair of sterile gloves are provided for use by the assistant or in case of contamination of the first pair of gloves. Obtain a second person for assistance. The second person will assist with assuring sterile process is maintained throughout the procedure and can help stabilize the line. This assures cross-monitoring and 200% accountability during the procedure. The second person may be a parent or assistive personnel familiar with the procedure. Perform hand hygiene. Use an alcohol-based hand sanitizer. If hands are visibly soiled, wash with soap and water. Hand hygiene prevents the spread of infection. Apply non-sterile gloves. If the patient has an active infusion, stop the infusion and disconnect the tubing. Cover the tubing with sterile threaded blue lock cannula and flush the line with sterile saline. Do not stop continuous medication infusions that need to run continuously, such as vasoactive medication. This prevents accidental dislodgement of the line during procedure. Clean your work surface. Use a designated work surface. Clean with hospital-approved sanitizer. The bed and linens are not clean and are unacceptable work surfaces. Remove and discard your gloves. Perform hand hygiene. Hand hygiene is performed after use of gloves. This removes any microbial hand contamination that occurs during the removal of gloves. Remove the dressing kit from the outer wrap. Place the kit at an angle on the work surface, with the corner of the top fold pointing toward the back corner of the work surface. Purell portable hand sanitizer packs are provided in the outer package, set aside for later use. Review the procedure checklist provided and set aside for reference by the assistant during the procedure. Open the first fold of the dressing kit sterile wrap and remove masks and sterile gloves. Set sterile gloves to the side. Sterile gloves are set off to the side so they are not under the sterile wrap when opened. Apply the mask to self, patient, and all within 3 feet of the patient. 3 masks are provided in the kit. Ask those who cannot wear masks to step out of the room. This decreases risk of contamination from airborne microbes. Continue opening the dressing kit sterile wrap. Grasp the corners of the folds of the wrap and open side folds and then front fold. Keep sterile wrap from touching your body while opening the folds. This assures the inside of the wrap remains sterile. Do not move the sterile wrap once open. Drop additional sterile supplies needed onto the sterile field. Do not lean over the sterile field when dropping items onto it. Apply non-sterile gloves. The removal of the old dressing is a non-sterile procedure. Remove the old dressing and discard away from the sterile field. Do not touch the CVC exit site or area under the dressing with non-sterile gloves. Loosen the dressing from outer edges towards the center, stretching to release from skin. The second person helps to secure the line with the sterile gloves if necessary when stat lock is not present. This maintains the sterility of the CVC exit site and area under the dressing. Visually inspect the insertion site and surrounding areas for signs of infection or irritation. Notify the physician of any signs of infection and document finding at completion of the procedure. Refer to the Rainbow Pediatric Central Venous Access Device Guidelines Dressing Guide. Remove gloves and perform hand hygiene. Discard gloves away from the sterile field. Use Purell portable packs for hand hygiene. Apply the sterile gloves. Open the sterile glove wrapper. Grasp the fold of one sterile glove cuff and insert the other hand into the glove. With the now gloved hand, place fingers inside the remaining sterile glove, keeping the thumb out. Place your other hand into the glove and pull the glove over the wrist. Now slide the fingers under the cuff of the first glove hand, keeping thumb out, and pull cuff over the wrist. Dressing change is a sterile procedure. Sterility of gloves are maintained while applying. Hand the second pair of sterile gloves to the assistant or set to the side of the sterile field. Gloves are provided for the use in event of contamination of the first pair of gloves, or if the assistant needs to help stabilize the line when a stat lock is removed. Open the Cavalon Skin Prep package and place back on the sterile field. Place the sterile drape beneath the site on the chest or under the extremity as necessary. A drape with a self-adhesive strip is provided for use beneath the chest catheter insertion sites. Drape to leave the area to be cleansed and dressed exposed. This assists in keeping the area to be dressed sterile. If placed under the extremity, the drape is not considered a sterile field. Pick up the ChloraPrep applicator with your dominant hand and cleanse the entire area to be dressed for 30 seconds. Groin and neck areas require 2-minute scrub. Squeeze the applicator wings to release the solution. Scrub using a gentle back and forth and diagonal motion. If stat lock present, use ChloraPrep applicator to loosen adhesive while securing the catheter at the insertion site. Friction aids in removal of bacteria. Remove the catheter from the stat lock if present and continue to scrub the area that was under the stat lock. Secure the catheter at the insertion site. Discard stat lock away from the sterile field. ChloraPrep deactivates stat lock adhesive. Stat locks are changed with every dressing change. Use ChloraPrep applicator to continue to scrub the catheter from the insertion site and any part of catheter to be secured under the sterile transparent dressing. Pick up the sterile tape measure to measure and note skin to hub external catheter length as necessary. Since the catheter will be coiled or secured under the transparent dressing, the catheter should be cleansed in the same fashion as the skin. Allow ChloraPrep to dry completely. Do not blot or fan dry. Failure to allow ChloraPrep to dry completely prior to applying transparent dressing can lead to skin irritation or dermatitis. Apply Cavalon Skin Prep to entire area to be covered by the transparent dressing. Begin at insertion site and move outward. Cavalon is compatible with CHG. Do not use ointments or creams under the dressing. Cavalon is a skin protectant that forms a protective barrier and assists with dressing adhesion. It is not an adhesive. Allow Cavalon to dry completely. Do not blot or fan dry. Failure to allow Cavalon to dry thoroughly before applying transparent dressing will result in poor adhesion of the dressing. Apply new stat lock if applicable. Attach the stat lock to the catheter with arrows pointing toward insertion site and lock in place. Attach stat lock to the skin. This aids in prevention of a PICC catheter from being dislodged. Apply sterile transparent dressing to the cleansed site. The catheter insertion site should be visible through the dressing window. The dressing should cover the Statlock or coiled Broviac catheter and should be completely occlusive. Do not chevron or wrap around the catheter. This prevents possible contamination of the site. Tape is difficult to remove from the catheter, and the catheter may rupture when tape removal is attempted. Remove gloves and perform hand hygiene. Purell portable packs are available in the kit for your convenience. Date and initial the dressing. Write the dressing date and initials of the person who performed the procedure on the white edge of the dressing. This alerts other practitioners of when the dressing was last changed. Resume infusion of IV fluids as indicated. Follow line entry procedure. Refer to the Rainbow Pediatric Central Venous Access Device Guidelines. Document the dressing change in EMR nursing work list. Standard transparent dressing is changed every 7 days. If gauze is present, change dressing every 48 hours. Schedule and verify the next dressing change in UH Care. Less frequent dressing changes reduces the exposure to microbial contamination. Discuss dressing and skin issues in daily rounds. This alerts team to potential for line and site and skin issues and allows for planning and mitigation of central line problems.